Hi, I'm Chris Robinson, your health insurance specialist here in Brevard, Volusia, and Flagler County with One Insurance Group. A lot of people have been asking me lately about Obamacare. What's going to happen with Obamacare with the new election, our new president-elect Donald Trump? Well, first of all, calm down, everyone. Nothing's going to change right away. The laws are in place, the plans are in place for next year, but let's take a look at what President-elect Donald Trump had to say on 60 Minutes this week about the very topic.
Let me ask you about Obamacare, which you say you're going to repeal and replace. When you replace it, are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period,
You're going to keep
very
that?
much try and keep that. Adds cost, but it's very much something we're going to try and keep.
And there's going to be a period, if you repeal it and before you replace it, when millions of people could lose.
We're going to do it simultaneously. It'll be just fine. That's what I do. I do a good job.
Okay, so folks, first of all, let's put politics aside for just a few moments, if we could, and discuss what's going on in the United States with healthcare reform and what was going on for the last few years with the increasing costs. A lot of times we forget health insurance premiums were increasing 13, 15, 16% every year for the last 5 to 10 years before the Affordable Health Care Act was put into place. Unfortunately, the Affordable Health Care has addressed making it affordable for some, but what it has not addressed is making it affordable for all by decreasing the claims and the utilization, especially for hospitals and prescription drugs. Hopefully, new-elect President Trump can address these issues and really rein in the healthcare costs, and that will eventually bring down the premiums. However, right now, the Affordable Health Care has the marketplace in place, and a lot of people are being able to take advantage of that and get a subsidy on the marketplace. There are three segments of the population that really benefit from this. First segment, employees of small companies. Under 50 employees at your company, your employer's not offering you benefits. You're making anywhere from $8 to $12, $13 an hour. Let's face it, folks, there's no way you can afford a $400 or $500 a month premium. You won't be able to pay your rent. You can come into our office. We can show you how to get a subsidy on the marketplace and get affordable health insurance. Instead of paying a $300, $400 premium, we've got people paying $20 a month, $50 a month, affordable health insurance. And here in Brevard, Volusia, and Flagler County, we've got great plans to show you. The second part of the population that's a great segment that is utilizing and taking advantage of the marketplace are early retirees. If you're 62, 63, you've retired early, whether voluntarily or involuntarily, you're collecting $1,200 to $1,300 a month in Social Security. There's no way you can afford an $800, $900 premium for your health insurance. Come into our office. I have clients that are collecting Social Security, and instead of paying a $900 health insurance premium, they're getting an $800 subsidy and paying less than $100 for their health insurance to bridge that gap until they turn 65 and get Medicare. A great segment of the population that I love that it's helping. So many people were going uninsured before they turned 65. Now they're getting the health insurance that they need. The last segment of the population that nobody wants to talk about is the small business owner. Yes, I said it. It's helping the small business owner. Because if you're a startup 2 to 3 years in your business and you're struggling to get your profits up and your income up, guess what? You can qualify for a subsidy based on your taxable income that you're showing. And until you get your business up and running, there's no way you can afford a $1,000, $1,500 premium for your family. So come into one of my offices, take a look at the plans, and we'll help you get subsidized. I'm putting up the chart right now that shows you who can qualify for a subsidy based on your income. For a single person, it's between $11,000 to $47,000 approximately. It's essentially 100 to 400% of the federal poverty level. If you're working, this helps the working poor, essentially. You're struggling, you're going to work, working your 40 hours, and you still can't pay your bills. There's no way you're going to be able to afford health insurance. This is who it targets. This is who it helps. It's not for you sitting at home doing nothing. Stay at home. Don't come to my office for the free health insurance. It's not for you. It's for those of us who are working hard, struggling, and still cannot afford to pay our bills. Family of 3, $20,000 to $80,000. You can still get a subsidy. I'm going to leave this chart up. You can pause it and take a look at it. Few very important dates right now. December 15th is the deadline to sign up for health insurance, effective January 1st. The open enrollment actually goes through January 31st. However, if you don't get health insurance by January 31st, you cannot get it again until next year, unless you have an SEP, which is a special election period, which essentially is triggered by something like you losing your job that you had health insurance, or you get a divorce, you lost health insurance through that divorce. So please, put the politics aside. Call my office, get educated. Let us show you how you can get a subsidy. Let us show you how you can protect your greatest asset. Not your house, not your car, not your boat, not your motorcycle, but your health. The ability to get up and work every day and provide for your family. My name is Chris Robinson. Thanks for listening. And our 3 offices here in Florida are in Melbourne, Rockledge, and Daytona. I'll leave that up there so you can have the phone number. Again, put the politics aside. Protect your family.